I'm a functional medicine physician, and I'm also a mom to an autistic kid. And while I love that we are trying to do more research on how to support families and children with neurodevelopmental disorders, there are some things that I think we need to talk about. First is the great amount of fear-mongering that is going into this campaign. While there are associations with Tylenol use and increased risk of neurodevelopmental disorders, they are not causally linked at this time. What we do know is that fever during pregnancy can lead to spinal cord defects. And this happens most commonly in the first trimester. So pregnant women, especially early in their pregnancy, need to treat fever. And while I may tell families that fever is our friend in any other time, during early pregnancy or with immunocompromised kids and elderly, we do need to treat that fever. So if you want natural alternatives, here are my go-tos. First, tepid baths. Get yourself in a cool body of water because that's going to cool your internal temperature. We want it back down below 100 degrees. And we do need a good core temperature, so thermometer under tongue or rectal temperature. Ginger and turmeric stop the inflammatory cascade, known as the cyclooxygenase pathway, or COX. So ginger tea is a great way to start off. Putting ginger in bone broth is even better because then you get proteins and amino acids. You can even do ginger capsules or turmeric over the counter. Supporting our immune system with nutrient-dense foods that are also easy to digest. Things that are rich and dark in pigmentation and color, so blueberries, strawberries, raspberries are great examples. Garlic and alums can also help. And we want to avoid other herbals that may be used for fever outside of pregnancy. Things like willow bark, pennyroyal, black cohosh, blue cohosh, mugwort, and essential oils. Remember, our goal is internal temperature less than 100.4 degrees. We don't need to be perfect, we just need to be out of the realm of fever. And if your body can't get there on its own, truly the most research-backed medication we have that is still the drug of choice is Tylenol. Make sure that it is Tylenol alone. Don't take a cold and flu remedy that contains Tylenol with Tylenol on top of it, and don't take other medications mixed in with the Tylenol. Make sure that you're staying under a total of 3 grams per day or 3,000 milligrams. And most importantly, let your care team know so that they can be involved. And if your child happens to develop autism, know that it's likely not from 1 or 2 doses of Tylenol that you took to treat fever. Know that truly it is a genetic and complex issue.